Hello, my name is Lisa Lackey, and today I'll be demonstrating how to hang a mini bag IV. I'm going to begin with verifying the doctor's orders, checking any labs, if any allergies, and comparing all that with the MAR, and making sure we don't have any contraindications for the patient, and making sure that the medication is compatible with what we'll be doing today. We will actually be administering 100 milliliters of saline, normal saline, over 30 minutes. The drop factor is 10, so that will give me about 33 drops per minute. I will go ahead and begin in the med room. I'm going to go ahead and prime the bag, get it spiked and primed. So I'm going to wash my hands. I'm going to go ahead and spike the bag. And I'm going to go ahead and label the bag. And on that, I will include my initials, the patient's name, dose, route, time, the arm, which is the location that it is administered into. And also, I will label the tubing with the date, time, and my initials, so they'll know that that'll be changed. Alright, and I'm going to go ahead and head to the room. I'm going to take with me a 2 milliliter syringe and some alcohol wipes so I can prime the INT line. So first I'm going to knock, introduce myself, and I will take a look at the patient's ID or wristband, get him to state his name and date of birth, and I'll compare that with my chart. That will be the two forms of ID that I use. And I will explain the procedure, make sure he knows what we're doing today. Next, I'm going to wash my hands, and I'm going to hang the bag. I actually did not mention that I primed it, so I'm going to go ahead and prime it right now. And I will be getting all of the air bubbles out. So, there we go. All the bubbles are out now, and so it is ready. I'm going to go ahead and hang it here for a minute.
It's freaking 500 ml every 6 hours. And I'm giving for this one.
Gotta clamp it, people. Gotta clamp it. Alright. So, I'm going to go ahead and get my gloves on. And I'm going to take a look at the site. I'm assessing for any redness, any tenderness, making sure there's no infiltration as well as no phlebitis. Everything looks good so far, so I'm going to go ahead and clean the port. I'm going to connect the normal saline so I can flush it, and I'm going to aspirate. Alright, I see a little blood, so I'm going to unclamp the INT, and I'm going to administer half of a milliliter of saline with this push and stop method, and I'll push another half a milliliter, and then stop again, and continue until I have 3 milliliters pushed all the way. Alright, now I'm going to reclamp it. I'm going to disconnect, and I'm going to go ahead and get my IV ready. I'm going to take and I'm going to open up a new alcohol wipe, and I'm going to clean the port again and connect the IV. I'm going to actually clean. I'll go ahead and wipe both. This would normally have a cap on it, but it doesn't, so I just said I'd clean it anyways. Alright, connect. And I'm going to unclamp it. Alright. And got that going. Alright, and now I'm going to open up the IV. Okay, and I've got to make sure that I've got the drips, or the fluid up to the line. And I'm going to watch the clock for up to 1 whole minute and make sure that I've got the 33 drops per minute. Okay. And we're good there. So now I'm actually going to go ahead and leave the room. I'm going to dispose of my gloves. And I'm going to head out, come back in 15 minutes and check on him. And then another 15 minutes after that, when the dose is complete, I will check on him as well again. And both times I'll be checking for any adverse reactions. Want to make sure there's no infiltration going on, no redness, tenderness. And this time I'm going to go ahead and disconnect. So I'm going to clamp. First off, I'm going to turn this off. And now I will clamp his IV, his INT, and disconnect it from the IV. Everything looks great. Yeah, so go ahead and hang this for the next administration. And at this point, I will go ahead and document the dose, the drug route, intake and output, the patient's response, the IV site, and I will make sure that all that goes into MAR, as well as I have to state if there was heparin that needed to be used, then at that point I would have used it, but you only do that with a doctor's order. So at this time, we're going to go ahead and I'll be back so that we can do the piggyback.